What happens to your prostate when you masturbate every day? The truth that doctors won't tell you. Did you know that over 1 in 8 men in the US will be diagnosed with prostate cancer during their lifetime? And yet the internet is filled with myths suggesting that a completely natural activity like masturbation could destroy your prostate. What if I told you the truth is the exact opposite, and that regular ejaculation might actually protect your prostate from cancer? Stick with me, because Harvard Medical School's research might just save your life. Before we dive in, hit that like button, share this video with a friend who needs to hear this, subscribe for more groundbreaking health insights, and leave a comment below with your experiences or questions about prostate health. Introduction: why your prostate matters more than you think. Your prostate is small, roughly the size of a walnut, but its importance is massive. Nestled beneath your bladder and surrounding the urethra, it produces seminal fluid that nourishes and protects sperm. But here's the part most men overlook. As you age, the prostate becomes increasingly vulnerable. By the time men reach their 60s, over 50% experience benign prostatic hyperplasia, BPH, which enlarges the gland and leads to those frustrating nighttime bathroom trips. And by the 70s and 80s, nearly 90% of men deal with BPH, according to the National Institute on Aging. Prostate cancer is another looming threat. It's the second most common cancer among American men, and if you live long enough, the odds are significant. About 1 in 8 men will receive a diagnosis in their lifetime. These alarming statistics have fueled decades of fear-based myths around sexual activity, particularly masturbation. Many believe it causes inflammation, infection, or even cancer. But what if all of that fear was completely misplaced? If you've ever worried that your daily habits could be harming your prostate, smash that like button, share this video with a friend, subscribe for more medically backed insights, and comment below if you felt confused about myths surrounding masturbation. 0-10 years, early adulthood and prostate health basics. During your 20s and 30s, your prostate is resilient and testosterone levels are at their peak. This is a time when regular ejaculation can play a surprisingly protective role. Scientific insight. Harvard researchers, led by Dr. Jennifer Ryder, tracked 31,925 men from 1992 for 18 years. They discovered that men who ejaculated 21 or more times per month had a 20% lower risk of prostate cancer than men who ejaculated only 4-7 times per month. Real-life example. Take Michael, a 28-year-old software engineer. He was concerned about prostate cancer due to family history. By incorporating healthy sexual habits along with exercise and a nutrient-rich diet, his annual checkups show optimal prostate health. This illustrates that early adult habits can have long-term protective effects. Why this works? 1. Prostate duct clearance. Regular ejaculation helps flush out potentially harmful substances. 2. Cellular renewal. Promotes healthy turnover of old cells. 3. Inflammation reduction. Sexual activity reduces chronic stress, which in turn lowers systemic inflammation. If you want to protect your prostate from a young age, hit like, share this with your friends, subscribe for regular updates on men's health, and comment your thoughts about this new research. 30-50 years, midlife and adjusting frequency. As men enter their 40s, subtle changes in hormone levels begin to appear. Testosterone, the key hormone influencing libido, muscle mass, and energy, starts a gradual decline, often by about 1-2% per year after age 40. Concurrently, the prostate may begin to show early signs of enlargement, benign prostatic hyperplasia, or mild inflammation, which can lead to increased urinary frequency, nocturia, waking at night to urinate, or a slightly weaker stream. Maintaining a balanced sexual routine can help support prostate health while minimizing discomfort. Recommended frequency. Men in their 40s, 3-4 times per week. Men in their 50s, 2-3 times per week. Scientific backing. Research continues to emphasize the protective role of regular ejaculation. A comprehensive study by Dr. Graham Giles in Australia, which included over 2,000 men, found that those who ejaculated more frequently, averaging 21 times per month, had a 36% lower risk of developing prostate cancer before the age of 70. This highlights that moderate, consistent sexual activity may help clear the prostate of potentially harmful substances and reduce long-term cancer risk. Practical example. John, a 45-year-old father of 2, began noticing subtle changes. He was waking up more often at night and experiencing mild urinary discomfort. By tracking his ejaculation frequency and pairing it with consistent exercise, a balanced diet, and stress management, he found a rhythm that worked for him. Incorporating lycopene-rich foods like cooked tomatoes and tomato paste along with omega-3-rich fish helped support his prostate health. Over several months, John noticed not only reduced nocturia but also improved overall energy and libido. Nutrition and lifestyle tips. Lycopene-rich foods, cooked tomatoes, tomato paste, and watermelon help reduce oxidative stress in the prostate. Green tea polyphenols, EGCG, found in green tea may slow the growth of prostate cancer cells. Omega-3 fatty acids, salmon, sardines, and fish oil help reduce systemic inflammation. Regular physical activity. Aim for at least 150 minutes per week of moderate exercise, brisk walking, cycling, swimming, or even vigorous gardening to support hormone balance and cardiovascular health. Weight management. Maintaining a healthy weight lowers the risk of aggressive prostate cancer and improves hormone function. Quality sleep. Aim for 7-8 hours nightly. Poor sleep can disrupt testosterone production and worsen urinary symptoms. By integrating these strategies, men in their 40s and 50s can better navigate midlife changes, optimize prostate health, and maintain sexual wellness. If you're in your 40s or 50s and you want to maximize prostate protection, hit like, share this with a friend, subscribe, and comment how you're adjusting your lifestyle for better health. 60+ years, later life and adjusting for safety. Men over 60 need to approach frequency with care. 1-2 times per week is typically recommended. At this age, the prostate recovers more slowly and underlying conditions like BPH become more common. Warning signs that require a urologist. Painful urination or ejaculation. Blood in urine or semen. Frequent or weak urination. Persistent pelvic or back pain. Special considerations. Men taking medications such as alpha blockers for blood pressure or prostate enlargement should consult their doctors before adjusting frequency. Family history doubles risk. If your father or brother had prostate cancer, early screening is crucial. Screening. African American men and high-risk men should begin PSA screening at 40. Regular checkups remain essential, even with frequent ejaculation. If you're over 60 or have a family history of prostate issues, hit like, share this video, subscribe for more expert-backed health advice, and comment any questions about screening or prevention. Prostate protection beyond ejaculation. While frequent ejaculation is protective, it is only one part of a comprehensive prostate health strategy. 1. Nutrition. Lycopene, polyphenols, and omega-3s. Focus on low-sugar, kidney-safe options for diabetic or renal patients. 2. Exercise. Regular, moderate-intensity activity improves outcomes post-diagnosis and reduces risk. 3. Stress management. Chronic stress increases inflammation. Meditation, yoga, or mindfulness help. 4. Weight and sleep. Obesity increases aggressive cancer risk. Sleep regulates hormonal balance and prostate function. 5. Medical monitoring. Regular PSA tests and consultations with a urologist remain essential. Final takeaways: what daily masturbation really does to your prostate. Harvard's research shows frequent ejaculation, 21+ times per month, can reduce prostate cancer risk by up to 20%. Mechanisms include flushing out carcinogens, promoting healthy cellular turnover, and reducing chronic inflammation. Optimal frequency depends on age, energy levels, medications, and personal health. Lifestyle factors like nutrition, exercise, sleep, and stress management compound protective benefits. Bottom line: daily masturbation is not only natural, but it may serve as a protective measure against prostate cancer. Fear-based myths are scientifically unfounded. Still, never replace regular checkups and screening with masturbation alone. Work with a knowledgeable urologist for individualized care. If you found this information shocking, hit like, share with a friend or family member, subscribe for more life-saving insights, and leave a comment below with your questions or experiences. Your prostate health matters, and the right knowledge can save your life.